Good morning. Bonjour. Thank you, Louise, and thank you to all the participants for joining us today for this virtual press conference regarding the publication of the Disability Advisory Committee's second annual report. My name is Adam Blondin. I'm from the Canada Revenue Agency, and I'll be your moderator today. Je suis Adam Blondin de l'Agence du Revenu du Canada, et je vais animer la séance d'aujourd'hui. Joining us from the Disability Advisory Committee are Dr. Karen Cohen, Committee Co-Chair, as well as Mrs. Sherry Torgman, Committee Vice Chair. The Disability Advisory Committee advises the Minister of National Revenue and the CRA on how the agency can improve the way it administers and interprets tax measures for Canadians with disabilities. Le Comité consultatif des personnes handicapées conseille la ministre du Revenu national et l'Agence du Revenu du Canada quant à la façon dont elle peut améliorer l'application et l'interprétation des mesures fiscales pour les Canadiens handicapés. On May 24, 2019, the Disability Advisory Committee released its first annual report, Enabling Access to Disability Tax Measures. Le 24 mai 2019, le comité a rendu public son premier rapport annuel intitulé Favoriser l'accès aux mesures fiscales pour les personnes handicapées. Today, the co-chair and vice chair of the DAC are pleased to release their second annual report. The second annual report provides an update on the recommendations the committee made in 2019 and puts forward a series of new recommendations. The report was posted on the CRA website a little bit earlier this morning, and links would have been provided to various reporters along with an invitation to this presser. After brief remarks, from Dr. Cohen and Mrs. Torgman, we'll invite you to submit your questions. Après une brève allocution de la part de la Dr. Cohen et Mme Torgman, nous vous inviterons à poser des questions. We are now ready to begin our briefing, and I'll turn it over to Dr. Karen Cohen for her brief remarks.
Good morning. My name is Dr. Karen Cohen, and I'm the co-chair of the Disability Advisory Committee. As mentioned, I'm joined today by Ms. Sherry Torgman, the committee's vice chair. The role of our committee is to advise the Minister of National Revenue on how the Canada Revenue Agency can improve how it interprets and administers disability-related tax measures for Canadians with disability. One of these key measures is the disability tax credit, the purpose of which is to give people with disability relief for their disability-related costs. The DTC is also the tax measure that serves as a gateway to other disability programs and supports. Je suis donc très heureuse de vous annoncer la publication de notre deuxième rapport annuel. Il s'inscrit en continuité du premier rapport que nous avions déposé en mai 2019. Our second report provides an update on the great progress that has been made in addressing the 42 recommendations in our first report. It also contains new recommendations and has 11 appendices with additional detail on various aspects related to tax measures for people with disability. The CRA has made many improvements since our committee was established and our first report was released. These improvements include changes to how the DTC is administered and how information about the DTC is communicated to its many stakeholders. For example, the CRA has created a navigator function to help individuals with complex cases work their way through the eligibility process. It is also developing an electronic application of the DTC eligibility form. All of this has happened despite the disruptions caused by the COVID-19 pandemic. We would like to highlight progress on the recommendations made in our first report and review several of the new recommendations in our second report. In Recommendation 2, we proposed a revised list of criteria to assess impairments of mental functions more accurately and with which to determine eligibility for the DTC. These criteria are clearer and more clinically meaningful for the healthcare providers who complete the DTC application forms. In Recommendation 6, the committee urged the CRA not to interpret the all or substantially all clause as symptoms that are present 90% of the time. Many people have severe and prolonged impairments that significantly restrict their lives with symptoms that are present less than 90% of the time. Pour ce qui est de la recommandation 14 concernant les soins thérapeutiques essentiels, nous avançons que tout traitement nécessaire au maintien des fonctions vitales demande, par définition, énormément de temps pour le prodiguer. Or, le temps nécessaire devrait être reconnu comme étant admissible. À la recommandation 15, nous croyons que le traitement des Canadiens handicapés sera plus juste si l'admissibilité automatique était disponible pour certains autres problèmes de santé, comme dans le cas de l'esthéticité. Before turning over to Sherry, who will review other of our new report's recommendations, I would like to take this opportunity to thank the hardworking members of the DAC for volunteering their time and expertise to this important work. I would also like to thank the leadership and staff of the CRA for their ongoing work and commitment to improving how tax measures are administered for people in Canada living with disability. The CRA has made many improvements to its DTC administrative processes, as well as to its communications regarding this important credit. However, there are significant legislative challenges remaining for both the DTC and other disability-related tax measures, like the disability supports deduction. To ensure our recommendations are adopted, the Disability Advisory Committee will continue to consult and collaborate on complex issues with the Canada Revenue Agency and other relevant government departments and stakeholders. Thank you for your time today, and without further ado, I'll hand the floor over to Sherry for her remarks.
Thank you, Karen. I'm pleased to join you today and to announce the publication of the committee's second annual report. It includes several new recommendations that we would like to bring to your attention. First, with respect to work-related tax measures for people with disabilities. We know that people with disabilities face higher than average rates of unemployment. And one of the challenges arises from the high cost of work-related equipment that they often must purchase on their own. And for this reason, the committee has highlighted the need to raise awareness of the disability supports deduction and to expand the list of eligible items in order to keep pace with technological improvements. With respect to Aboriginal issues, the committee recommends promoting access by Indigenous communities to the disability tax credit, developing a DTC assessment tailored to Indigenous claimants, and exploring ways to collect DTC data for Indigenous claimants. Concernant la poursuite des décisions relatives au crédit pour personnes handicapées, dans ce cas, nous encourageons l'agence à considérer de nouveaux mécanismes de règlement des différends relatifs au crédit, comme la nomination d'un arbitre indépendant. And with respect to registered disability savings plans, these are plans that are intended for persons with severe disabilities, and they enable people with disabilities or their parents, their families, their friends, for others to contribute to the long-term financial security of an individual with a disability. And the federal government provides grants and bonds for lower income individuals, but applicants must first qualify for the disability tax credit in order to open an RDSP. And in our first annual report, we highlighted a specific problem. The fact that people who have already opened an RDSP, and if they're deemed ineligible for the DTC, they have to close their RDSP. And we argued that this was unfair, that especially with respect to the RDSP grant and the RDSP bond, that they should be able to keep those funds. We were very pleased, actually, that the 2019 federal budget announced the elimination of this requirement to close an RDSP when the individual no longer qualifies for the DTC, so they can keep their RDSP open. And we propose retroactively paying the RDSP grant or bond portions to eligible holders. We have also recommended that an advisory body be established to address concerns and emerging issues regarding how RDSPs interact with the disability tax credit. Finally, we will continue our discussions with the CRA and all government bodies to review how the DTC, the disability tax credit, serves as a gateway for people with disabilities to access other disability-related benefits. We know that it's problematic for some people with disability who are prevented access to other important programs because they don't qualify for the DTC. Comme Karen l'a mentionné, en collaboration avec l'Agence du revenu du Canada, nous avons fait un excellent travail et nous avons encore du travail à faire. Le comité est résolu à jouer son rôle dans l'amélioration de l'équité fiscale des personnes handicapées. Nous vous remercions pour votre attention. Merci. Thank you.
Thank you very much. We're now ready to begin the Q&A session. Karen and Sherry are obviously looking to focus on questions pertaining to the publication of their annual report. Nous sommes maintenant prêts à commencer la période de questions et réponses. We'd ask that you limit yourself to one question and one follow-up. Veuillez vous limiter à une seule question et une question de suivi. Operator, back to you.
Merci, thank you. Please press star 1 at this time if you have a question. Appuyez sur étoile 1 pour toute question. La première question est de Tom Rorsky, Blackbusters reporter. Please go ahead. À vous la parole.
Thank you, Dr. Cohen. Last year we discussed refusal rates, and you said, we don't know why some of these rates are very high. Table 11, rejection rates for hearing claims over a 5-year period, approximately double, though the number of applications are static or express, exponential normal growth. Speaking claims up. Mental functions doubled, rejection rates doubled over the 5 years. You've had a year to look into this. Why? Why are some of these specific applications being rejected at much higher rates?
Thank you for the question. I'll start off and then maybe Sherry, you can jump in after. One of the things we realized that was really critically important to understand more about the credit, what the barriers are to accessing it, and what are some of the challenges people are experiencing and getting approved was data. And that was why in this report you'll see an appendix full of a bunch of data tables so that we could better understand exactly who is getting it and where and why. There are a lot of things that emerged when looking at the data. Particularly, regional differences in terms of whether claims were accepted permanently or indeterminately or temporarily, different mental functions having higher rates in different areas of the country, under overrepresentation of claimants in certain regions. So our committee is actually meeting in April, and on the agenda is really to look at what some of this data is showing and try to take a deeper dive to understand what some of the barriers are. In terms of numbers of applications, I think one of the things that happens when you communicate better and people are more aware of a credit or a program, you get more applicants. But I think there are definitely more questions to be answered by looking through the data that we have access to. Sherry, perhaps you'd like to add something.
Thank you, Tom, for your question. And as Karen mentioned, we will be looking at these now that we have some, data from 2 years, and we can look at the comparison, or from several years, look at the comparison over time to see some of the trends. We are trying to enable access to the DTC credit for people with impairment in mental functions. We know that for years that has been a real problem, and many of our recommendations are focused on that particular segment of the population. But we recognize that there are other issues as well, and that data has been very interesting to point out to us. And as you noted, for example, the problem with hearing. In our first report, we recommended looking into the criteria with respect to hearing in particular, because we noted that it is out of date. And so the CRA has been meeting with a number of organizations representing hearing impaired Canadians to identify, how they might improve the criteria. So we will be looking at this data over time. It's a really important barometer to indicate to us where the problems are and how to focus in on specific areas that need more work.
My follow-up, you're aware Cabinet has not gazetted, but published its executive order that it will cap at $100 a year consultants' fees for assisting people who presumably are among these applicants who have very high rejection rates. You're aware of the proponents of the fee cap have made their case. Tax consultants have said, good luck to you if you want to take on the Canada Revenue Agency on appeals without a tax consultant. Good luck. That this weights the scale heavily in favor of the agency in rejecting legitimate claims. Comment?
Sorry, I can start, Jerry, and then perhaps you can continue. I think this is something that we discussed last year as well, that one of the things I think that's an imperative is to make the application process and the eligibility criteria clearer so people can access it. Because as you point out, one of the roles of promoters has been to help people navigate what's been a complicated process. If we work at making that process easier and more accessible, some of the administrative changes that have already been put in place with navigators, hopefully people will need less help in navigating what's a complex process. That work, I think, needs to be done regardless. In terms of caps, our goal is to see that when people are eligible to receive the credit, that the credit goes to them. Sherry?
Thank you, Karen. Thank you for your question, Tom. And just to follow on what Karen was saying, many of our recommendations, as Karen mentioned, are intended to enable access to the disability tax credit and to clarify and simplify the process. And there's a whole set of measures that have been put in place in order to do that. So just as one example, the CRA is introducing a navigator function for complex cases. And, so when an individual with complex needs is trying to navigate through the system, there will be somebody who will be there to help them. Many of the other recommendations that we've made, for example, an electronic application form, will make it easier for people to apply for the disability tax credit. So we're hoping that at least at that end of the spectrum that, we will enable eligibility. We've also made some recommendations about the appeal system because we recognize how very difficult and complex that system is. And we want to continue, to monitor those changes to make sure that at that part of the process, well, first of all, to avoid it if possible, but second, to make that part of the process a lot more user-friendly for those people who do need to or who feel they need to appeal their cases. So there's a sort of a range or a spectrum, of efforts that we're trying to, actions that we're trying to take to improve access and then make it easier for people who want to challenge their decisions.
Thank you, merci. Next question, la prochaine question is from Jolson Lim from iPolitics. Please go ahead, à vous la parole.
Hi there, good morning. I was hoping you can talk a bit more about kind of the key issue in the first report, which was that, many Canadians with serious health conditions related to mental functions are being left out from accessing the credit. So I'm kind of wondering, what has the government really done, if you can elaborate more, what has the government done to date to really address that, and also kind of what has it done, in relation to the recommendation that the panel made, which was, to clarify the definition and eligibility criteria, to put it in similar line with physical impairments.
Yes, you're quite right. That's been a key area of focus and attention for the committee, and one of the areas where work still remains to be done. Part of the challenge is there's an administrative component, in other words, making forms easier, making guidelines easier to make decisions on eligibility decisions, but there's also a legislative component, what is actually in the legislation as concerns eligibility for mental functions. In the committee's view, changes need to occur in both places, and of course the CRA's purview is more on the administrative end. I think they've done a fair bit of work revising the T2201 form and digitizing the form that we're hopeful will make it easier for health providers to make the decisions around whether their clients are eligible and how to complete those forms. But the committee also believes that the legislative definition of eligibility and mental functions itself needs to change because that will greatly enhance clarity for the health providers who are filling out the forms on behalf of their patients. In other words, what constitutes mental function, what constitutes impairment, there needs to be some clinical clarity there for health providers, for sure. Sherry?
Thanks, Karen. Thank you for your question. And just to add one component to what Karen said, we've also recommended a secondary review when somebody who has applied with impairment in mental function is refused and all the, the forms are properly filled in and all the administrative criteria are appropriately met and they are refused. We have recommended a secondary review to ensure that, the initial decision was appropriate and just to have another team have a second set of eyes on that decision. So there may well be other kinds of, processes that need to be put in place. But between the administrative improvements and legislative improvements that Karen referenced, and then some of the procedural improvements that we see, we're hoping that over time we will see, a sort of improvements with respect to the numbers in that particular area.
And specifically, what kind of legislative changes would you like to see? And as well, kind of jumping onto a somewhat different topic, we saw that $600 benefit go out during the pandemic. The minister said that, too few people received it. I assume that you would agree as well that the disability tax credit kind of serves that gatekeeping function toward that $600. In that case, does it speak to a need to, seriously reform the disability tax credit, or does it speak to, a need to, tear it down completely and replace it with something better?
So thank you for that. I'll start off, and then Sherry, maybe you can answer the second part. The kinds of legislations, for example, that we're talking about, changes around mental functions are mainly this. In the legislation, for example, it refers to several symptoms of impairment in mental functions that must be taken together. In other words, you must have all of them. They must be interpreted conjunctively and not disjunctively. We've proposed instead another set of criteria that involve all aspects of mental functions and that they not be interpreted in a conjunctive way, because that's not the case for any other disorder. If you're impaired and it restricts your functioning, it restricts your functioning. If you can't walk, whether it's a neurologic thing or an orthopedic thing, if you can't walk, you can't walk. And so we're looking for parity in how the wording appears in the legislation for mental functions as well. So that's the nature of one of the legislative changes. The other we've been working at is how all or substantially all is interpreted. Must your symptoms be there? What does it mean to say all or substantially all? And we've been suggesting that you can have very severe and profound impairments that are so significant, but not necessarily there 100% of the time or 90% of the time. So that would be another example. As for the deduction, I think, Sherry, maybe you might be better placed to answer that.
Thanks, Karen, and thanks again for your question. That's a fantastic question, and how much time do we have to discuss this issue? Because it's really I think it's central. Such an important question. Let's talk about the COVID benefit in particular, because you're quite right that when it was first announced, the disability tax credit was the primary eligibility criterion for receiving of the COVID benefit. And there was great concern in the country that this would leave out far, far too many Canadians. And so the government agreed and finally opened up the eligibility criteria to include a range of other programs, so that if you're eligible, for example, for the Canada Pension Plan disability benefit or a veterans benefit, that is disability related, or any other key disability-related program, including the DTC, then you would be eligible for the COVID benefit. So I think you're quite right that this particular incident showed, that using the DTC as a gateway was problematic from many respects because it left out so many people. And so as an interim measure, what we've been looking at and proposing is that there be several other programs that can act as gateway, to other disability-related benefits, that it doesn't just have to be the disability tax credit, that it could be a range of other benefits. And over time, you may want to consider, entirely doing away with the DTC as a gateway. Having said that, though, it does carry out, it does fulfill a specific function. Its other purpose, in addition to the gateway, is to recognize additional disability-related costs that people with severe disabilities face. And so if we phase it out, then we're losing that function, and we want to be careful what we do in thinking about any bigger reform. You don't want to lose that initial function, or at least you want to make sure that it's captured somewhere else. So it's a very complex question that you're asking, but I think for a simple answer, the DTC is not sufficient as a gateway. It has to be seen as one program that allows eligibility to other disability programs as an interim measure.